My thoughts about chiropractic was that you were supposed to come to a chiropractor when you were hurt. My dad had a chronic back problem, and that's the only time he would go to the chiropractor is when he couldn't get out of the bed.
I was a little bit hesitant and not real informed. I was a little bit fearful that it might hurt and didn't really understand the process too much, but I was curious.
I've had chiropractic care, and my perception was that you become dependent on it and that you never progress, that you just have to keep going, and that I'm so busy, I just put it off.
Well, I know my mom had done some chiropractic care prior to moving here back when I was younger, so I'd heard about it, and that's kind of when I injured my back. That's kind of the first thing that came to my mind. I said, "Oh, I'll go to the chiropractor. That's what you do when you hurt your back." So that's really all I knew about it, and didn't realize there was a little more to it than that. But
I had never heard of it. I never heard of it. I mean, that was 1964.
They were positive. I'd seen chiropractors before. I mean, I played high school golf, and I'd had issues stemming from previous injuries, like just high school, just playing sports, and I was very open to it, and I had seen results in the times I'd gone before. So upon seeing him, I was very open to it.
Thought it was voodoo witch doctor.
I've always been a person that did not like, I had tried it one time after a car accident, and I do not like to be cracked. And I had to have therapeutic massage at that time that wasn't successful. It was very painful. So my initial thoughts were, I don't want to go to a chiropractor.
I've been going for 5 years, and seem to come back every week.
Well, this sounds crazy, but I tell people this all the time, that I felt like when I started coming to Family First Chiropractic, it changed my life. And it really did. I felt like all of a sudden I felt well, I felt good, I was happier because I felt good.
A couple times was, well, maybe something's happening, but I'm not really sure, but I'm going to continue and just keep going because I understand it might be a little bit longer process, which it was, but then I saw that things were definitely happening, that I was feeling better.
Oh, well, when I first had the issues and I first started going to a chiropractor, it didn't happen overnight, but within a week and a half, I could do simple movements because my back was thoroughly locked up. I could do simple movements without having any pain, and I could actually get up on a walker and walk to the bathroom before I'd have to crawl, and it was very painful. But at first I didn't. You're so desperate, you'll want to try anything, and thank God I tried that as opposed to going to a doctor and get under the knife and have whatever they do, I don't know, but this way there was no blood involved whatsoever, no stitches, none of that stuff. It was simply them straightening my muscles out, making them do what they did back in 1951 when I was a little guy.
I noticed improvement, and I noticed that, yes, I went more often in the beginning, but I was able to wean off to fewer treatments, and I was pretty surprised that through x-rays I could see the evidence that I had progressed.
well, I thought, this is expensive.
Oh, yeah.
Truthfully, full disclosure, it's expensive, but I thought, this is, it was really important. I felt like once I fully understood it, I had a better idea of how, like, anatomy and physiology. I had a baseline understanding of that from my job, but I guess I had a greater appreciation for it. And I really thought, man, this is something that guys in my profession, we should be doing this almost as a preventative, because low back injuries are extremely common in the EMS professions. We're commonly having to lift and twist and get into awkward positions with heavy equipment and lifting patients, and people aren't getting any lighter nowadays. And so I thought, this is something I want to continue with, to be proactive.
I really do think that Dr. Che has a method of allowing comfort and confidence in his clients in order to move towards being fully adjusted in such a way that I wasn't nervous, that I was able to open up and talk to him about my past experiences that were not good, and that he also is such a natural, kind person that he shared with me that he also didn't like the concept of being cracked, and that the adjustment part of it has been absolutely wonderful, because it's not anything like I had experienced before.
Nobody had ever told me about it, and then I did find out about it, and there was one particular person in the city that I was in, and I just thought, I've got to do something that makes sense to me to help myself, and that's what I found.
Yeah, so I try to be more preventative, and I just believe in understanding his thought that he's put into the industry, and knowing that if you really dedicate yourself to being preventative, then you'll be healthier in the end. So I try to pursue the preventative route, but also I've had issues from old sports injuries and things like that, so I've tried to take care of that. Also, I've had migraines in the past, and he said if you'll come see me and be preventative about keeping your body in shape, you'll have less migraines. And sure enough, it's been quite a different life without experiencing those.